Good morning and welcome back to GP Video Podcast by Nadia. So as you know that I have made a lot of video podcasts on the causes of fatigue, because as you know that fatigue is a very vast presentation and it's a vast area of symptom complex which includes a lot of symptoms in it, both mental fatigue and physical fatigue symptoms. So tiredness, sleepiness, lack of energy, depressed, all of these kind of symptoms are all clustered together under fatigue symptoms. And then because fatigue is a vast array of symptom complex, again the causes are a lot, and not only one single cause is usually identified. Usually there are so many factors, so many causes, so many conditions at the bottom of a person's condition of being fatigued. So I've discussed this in detail: physical causes, mental fatigue, physical causes contributing to mental fatigue, mental causes contributing to physical fatigue, and vice versa. And psychosocial factors, lifestyle factors, and work-related stressors, and all of that. But people have been actually asking me, what is the treatment? So the answer is very simple. Answer is as many factors, as many causes a GP can find for the cause of fatigue in a particular person. Treating those causes is the treatment. So treatment, for example, if a person is found to be hypothyroid or hyperthyroid, endocrine and metabolic disorders, of course, treating that hyperthyroidism or hypothyroidism is the treatment. Or if a person is found to be vitamin B12 deficient or vitamin D deficient or iron deficient, so supplementation with multivitamins is the treatment of fatigue. If a person is found to be depressed, depression is the diagnosis, generalized anxiety disorder is the diagnosis, ADHD is the diagnosis, then treatment with medications for ADHD, treatment with antidepressants, treatment with anti-anxiety medications is the answer. Usually, what I do is with my patients, I put them on a multivitamin for sure, because there are multivitamins that are called chronic fatigue fighters, or for example, there is a brand called Caruso's Get Up and Go, which is very, very good for very, very good source of multivitamins that can infuse an energy or infuse replace the vitamins that are being lacked in a person. So as I said, that vitamin B12, iron, and vitamin D are usually at the bottom of a person. Their deficiency can cause fatigue. So but then we can replace all of those. So a nice multivitamin which has everything, plus supplementing iron separately, supplementing vitamin D separately, supplementing vitamin B12 separately if they are deficient as well. If they are not deficient, then just a normal one multivitamin, nice multivitamin complex should be enough a day. So treatment of the cause is the treatment of fatigue. How many, like if a person is found to be a diabetic as well as hypothyroid, so treating diabetes plus thyroid is the answer. But apart from that, if other measures need to be used. So for example, Modafinil is a medication which is usually given to people who are chronic shift workers. So for example, 1 week they work in an afternoon shift, the other week they work in night shift, the other week they work in morning shift. So for chronic shift workers, the fatigue and sleepiness is treated by something called modafinil. Modafinil is a non-amphetamine psychostimulant. So it stimulates the brain, and thus you feel more energetic, thus you feel more awake, thus you feel more like you can concentrate on your work. So modafinil can be prescribed by the GP if he thinks that's appropriate. Then another medication is phentermine or duromine. Duromine is usually approved in Australia for weight loss because it suppresses appetite, but it is a psychostimulant as well, and it can increase your energy levels, it can increase your concentration levels, and because it mimics the properties of ADHD medications, which are amphetamine psychostimulants, so what happens is it also helps people who have underlying ADHD. So ADHD meds, duromine or phentermine, or modafinil. These medications can also be used for short term for increasing the concentration levels, increasing energy levels, and stimulating brain and getting you out of the fatigue. But they are all short term medications. If you are diagnosed with ADHD properly, then you can be on ADHD medications for a long time, even for lifetime. Some people are there on it. Antidepressants, again, are good if you are diagnosed with depression. Otherwise, modafinil and phentermine. Phentermine is also a short-term medication. Maximum it can be used for 3 to 6 months, not more than that. So it can give you some temporary relief. And that is like an amphetamine psychostimulant again, while modafinil is the non-amphetamine psychostimulant, so it has got lesser properties of addiction. So basically what I mean is the treatment of the cause is the mainstay. Multivitamins and then some off-label medications can be used. Some conditions like there are some conditions which are autoimmune, which can be helped with the steroids. Steroids in short term can also increase the energy levels and the concentration levels, but then again, they are a very short term medication. But in some conditions, they can be given in low doses on long term basis. But again, those conditions are the ones that need to be diagnosed and then treated by specialists and GPs. So my point is that investigation is very, very important. So GP will run blood tests, GP will do scans, GP will take a detailed thorough history, will do detailed physical examination, and all the factors, all the causes contributing to fatigue will be established, and then they will be treated. So if you've got 2 to 3 conditions and you need to be on 2 to 3 treatments, then they all together can treat your fatigue. I'll see you soon.